You've been told your blood pressure is high because you're getting older. Maybe your doctor said it's genetics. Maybe they handed you a prescription and said, this is just how it goes after 60. And maybe, just maybe, you believe them. Because it seemed logical. Because everyone around you is on the same medication. Because you thought, well, what else can I do? But I want to stop you right there. Because after 28 years of practicing cardiology and preventive medicine, I can tell you with complete confidence, for millions of people over 50, high blood pressure is not an inevitable consequence of aging. It is the consequence of a handful of correctable, reversible, and surprisingly simple daily habits that no one ever explained to you. I'm Dr. Jonathan Reed, and in this video, I am going to show you the science, real peer-reviewed research from institutions like Harvard, the American Heart Association, and Johns Hopkins, that proves your arteries are far more responsive to lifestyle change than your doctor may have led you to believe. Now here is the part that may genuinely surprise you. The single most impactful daily habit for preventing and reversing hypertension after 50 is not a medication. It is not a supplement. It is not an expensive therapy. It is something so ordinary that you have access to it every single morning when you wake up. And the reason most people aren't doing it correctly, or at all, is not because they're lazy. It's because no one broke it down for them in a way that made the biology click. By the end of this video, I will give you a clear, step-by-step daily protocol you can begin tonight, not next month, tonight, to start protecting your arteries, lowering your blood pressure naturally, and reclaiming the energy and clarity you thought you'd lost for good. But I want to warn you about something first. The third habit I'm going to share is the one that most people skip, and ironically, it may be the most dangerous mistake of all. So stay with me to the end. The order here matters. Before we dive in, leave a comment below and tell me, are you currently on blood pressure medication? And has any doctor ever sat down with you for more than 5 minutes to explain why your pressure is high? I read every comment, and your answers genuinely shape this channel. Now let's begin. Most people think of blood pressure as a plumbing problem. The pressure is too high, so you take a pill to lower it. Simple, right? But that framing misses something critically important. And it's the reason so many people stay on medication for decades without ever actually getting better. Here is what is really happening inside your body. Your arteries are not rigid pipes. They are living, muscular tubes lined with a single layer of extraordinarily sensitive cells called the endothelium. Think of the endothelium like the inner coating of a garden hose, except this coating is alive, it breathes, it communicates, and it produces chemicals that either relax your blood vessels or constrict them. When the endothelium is healthy, it produces a molecule called nitric oxide. Nitric oxide is essentially nature's own blood pressure medication. It signals the smooth muscle wrapped around your arteries to relax, dilate, and allow blood to flow freely. A 2017 study from the University of Alabama found that adults over 60 with healthy nitric oxide production had systolic blood pressure readings an average of 14 points lower than those with impaired production. That is a clinically significant difference. That is the difference between being on medication and not being on medication. But here is the problem. After the age of 50, nitric oxide production begins to decline by as much as 50% by the time you reach your late 60s. And the habits I'm about to share with you are the most evidence-backed ways science knows of to restore that production, protect your endothelium, and give your arteries what they need to do their job. Now, I want to introduce you to someone. Her name is Dorothy, 68 years old, a retired school teacher from Columbus, Ohio. Dorothy came to my office 3 years ago with a blood pressure reading of 158/94, firmly in stage 2 hypertension. She was already on one medication and her doctor was discussing adding a second. She was tired all the time. Her ankles were swelling. She felt, in her words, like she was slowly disappearing. Dorothy had not been given bad advice exactly. She had been given incomplete advice. And incomplete advice when it comes to your cardiovascular system can be genuinely dangerous. So let me give you the complete picture. Let's start with something so fundamental that most doctors consider it too obvious to mention, and that omission is a serious mistake. When you wake up in the morning, you have been without water for 7 or 8 hours. Your blood is thicker, your blood volume is lower, and your heart is working harder to push that thickened blood through your vessels. A 2020 study published in the American Journal of Physiology found that mild dehydration, as little as 2% below optimal levels, causes measurable increases in blood viscosity and elevates systolic blood pressure by an average of 7 to 10 points within just 2 hours. Here is what makes this especially urgent for people over 60. Aging diminishes your thirst sensation. Your kidneys become less efficient at conserving water overnight. You wake up dehydrated without feeling thirsty, and you reach for coffee, which is mildly diuretic, before your body has had a single drop of water. You are starting your cardiovascular day in a deficit. The fix is almost embarrassingly simple. Keep a full 16-ounce glass of filtered water on your nightstand. Before your feet hit the floor, before your phone, before your coffee, drink the entire glass. This one act rehydrates your blood, reduces viscosity, and begins lowering the mechanical load on your heart within 20 minutes. But there is a synergy tip here that most people miss. Add a 1/4 teaspoon of natural potassium-rich mineral salt or a small squeeze of lemon juice. Potassium is one of the most clinically validated nutrients for blood pressure regulation. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, and which the American Heart Association endorses, is built in large part on increasing potassium intake. Research from Harvard School of Public Health found that every 1,000 mg daily increase in potassium intake was associated with a 2 to 4 point drop in systolic blood pressure. Starting your morning with that mineral foundation sets your vascular chemistry up correctly from the very first minutes of the day. Dorothy, the patient I mentioned, started with just this single habit. Within 3 weeks, her morning blood pressure readings dropped from an average of 156 to 144. One habit, no new medications. But hydration is only the foundation. What you do next, in the first 30 minutes after waking, is where the real biology begins. Remember nitric oxide, the molecule your endothelium produces to relax your arteries? Here is the extraordinary thing about it. You can dramatically increase your body's nitric oxide production through a specific category of foods. And the science behind this is some of the most exciting cardiovascular research of the past decade. Beetroot and dark leafy greens like spinach, arugula, and Swiss chard are extraordinarily rich in dietary nitrates. When you consume these foods, bacteria on your tongue, yes, your tongue, convert those nitrates into nitrite. Then your stomach acid converts nitrite into nitric oxide, which enters your bloodstream and begins relaxing your arteries almost immediately. A landmark 2015 study from Queen Mary University of London found that drinking just 1 cup of beetroot juice daily lowered systolic blood pressure in hypertensive patients by an average of 8 points over 4 weeks. 8 points. That is equivalent to the effect of a low-dose blood pressure medication with 0 side effects. The researchers concluded that dietary nitrates represent one of the most underutilized tools in cardiovascular prevention. Now, here is what most people get wrong about this. They hear beetroot, and they imagine drinking earthy, strange-tasting juice every morning for the rest of their lives. You don't need to do that. A large handful of raw spinach in a morning smoothie, or a small serving of arugula with lunch, delivers a comparable nitrate load. What matters is consistency and frequency, not volume. Here is the critical preparation mistake to avoid. Do not use mouthwash within 2 hours of consuming nitrate-rich foods. Antibacterial mouthwash kills the tongue bacteria responsible for the nitrate to nitrite conversion step. A 2018 study from the University of Plymouth found that using mouthwash twice daily was associated with a 2 to 3.5 point increase in blood pressure by eliminating this natural conversion pathway. The mouthwash companies will not tell you that. Now we reach the habit that most people either skip entirely or dismiss as too soft to be medically meaningful. And I want to be very direct with you. Skipping this one is almost certainly the most expensive cardiovascular mistake you are making. Slow, controlled breathing, specifically techniques that extend your exhale to twice the length of your inhale, directly activates your parasympathetic nervous system. That is the biological counterweight to your stress response, and the mechanism through which it lowers blood pressure is not subtle. It is immediate, measurable, and compounding over time. Here is the biology. When you are under stress, chronic, low-grade stress, of the kind that is almost universal in people over 60 managing health concerns, finances, family, and loss, your sympathetic nervous system keeps your body in a state of mild fight or flight. Cortisol stays elevated. Your arteries remain slightly constricted. Your kidneys retain more sodium. Your heart beats slightly faster. All of this raises blood pressure around the clock, even while you sleep. A 2021 randomized controlled trial from Stanford University Medical Center found that 6 weeks of daily slow breathing practice, just 5 minutes per day, reduced systolic blood pressure by an average of 9 points in adults with stage 1 hypertension. The mechanism was a measurable reduction in sympathetic nervous system tone, confirmed by heart rate variability testing. Here is the exact technique. Inhale gently through your nose for 4 counts. Hold for 2 counts. Exhale slowly through your mouth for 8 counts. That extended exhale is the key. It directly stimulates the vagus nerve, which is the master switch of your parasympathetic system. Do this for 5 minutes each morning after your water and before any screens. 5 minutes. That is the entire intervention. I had another patient, Richard, 74, from Tucson, Arizona, who was deeply skeptical. A retired engineer, numbers-oriented, not at all interested in anything that sounded like meditation. I told him to think of it as recalibrating a pressure gauge. He agreed to try it for 30 days. At his 6-week follow-up, his average blood pressure had dropped from 151/88 to 138/80. He told me, "I don't know what it is, but it works. The science knows exactly what it is." But here is where the story gets complicated. Breathing alone is not enough. And the reason most people plateau, even when they do everything else right, comes down to something happening in their gut that almost no one is talking about. This is the part of the conversation that most cardiologists are still catching up on. And the research is moving so fast that even the most current clinical guidelines have not fully incorporated it yet. Your gut microbiome, the trillions of bacteria living in your digestive tract, plays a direct and powerful role in regulating your blood pressure. The mechanism works through a compound called trimethylamine N-oxide, or TMAO. When certain gut bacteria process red meat and processed foods, they produce TMAO, which damages the endothelium, that delicate arterial lining we discussed earlier, and significantly elevates blood pressure. But there is a flip side. When your gut contains a healthy, diverse population of beneficial bacteria, they produce short-chain fatty acids, particularly butyrate, that actively protect your endothelial cells, reduce arterial inflammation, and support healthy nitric oxide production. A 2019 study from the University of California, San Diego followed 2,632 adults and found that microbiome diversity was one of the strongest independent predictors of blood pressure levels, stronger in some subgroups than body weight. That is a remarkable finding. For people over 60, the gut microbiome faces a specific challenge. Diversity naturally declines with age. Antibiotic use, common in older adults, further reduces beneficial bacterial populations, and diets low in fiber give the remaining bacteria little to work with. The intervention here is straightforward but requires consistency. Add 1 to 2 servings of naturally fermented food to your daily diet. Plain yogurt with live cultures, kefir, kimchi, or sauerkraut. Pair these with prebiotic-rich foods that feed your beneficial bacteria. Garlic, leeks, cooked and cooled sweet potato, or lightly underripe bananas. The combination of probiotics plus prebiotics creates what researchers call a symbiotic effect. The new bacteria arrive and immediately have food available, dramatically increasing their survival rate. Dorothy started adding morning kefir and a small portion of sauerkraut at lunch in month 2 of her protocol. By month 3, her cardiologist repeated her inflammatory panel. Her CRP, C-reactive protein, a key marker of vascular inflammation, had dropped by 31%. Her blood pressure responded accordingly, consistently below 135/82, without any medication changes. Exercise lowers blood pressure. You have heard this 1,000 times. But here is what you have almost certainly not heard. The timing of that exercise may matter as much as the exercise itself. And for people over 60, exercising at the wrong time could actually be counterproductive. A groundbreaking 2023 study from the University of Sydney followed 23,000 adults and found that people who performed moderate-intensity physical activity in the evening, specifically between 6 p.m. and 8 p.m., showed significantly greater reductions in blood pressure and arterial stiffness than those who exercised in the morning. The mechanism appears to involve the body's natural cortisol rhythm. Cortisol, which constricts blood vessels, is highest in the morning and gradually falls throughout the day. Evening exercise does not compete with that cortisol peak the way morning exercise does, allowing the vascular benefits of movement to be fully expressed. This does not mean morning movement is harmful. The morning hydration and breathing habits are still essential, but your primary cardio session, the sustained 30 to 45-minute moderate walk, belongs in the evening. What counts as moderate intensity? You should be breathing noticeably harder than normal, able to speak in short sentences, but not comfortable enough to hold a lengthy conversation. This level of effort, maintained for at least 30 minutes 5 days per week, is associated with a sustained reduction in systolic blood pressure of 5 to 8 points, according to a comprehensive meta-analysis from the Cochrane collaboration covering over 391 randomized trials. The additional benefit for older adults is this. Evening walking directly improves sleep quality, which brings us back to the master regulator. Sleep deprivation raises blood pressure. A single night of poor sleep increases next morning blood pressure by an average of 6 points. Proper sleep restores it. The habits work as a system, each one reinforcing the others. Let me bring everything together into what I call the daily pressure protocol. 5 habits, sequenced deliberately, that your arteries can respond to starting tonight. In the morning, drink 16 ounces of filtered water with a squeeze of lemon before anything else. Follow it with 5 minutes of slow, controlled breathing, 4 counts in, 8 counts out. Have a breakfast that includes a nitrate-rich food, a handful of spinach in a smoothie, or arugula on eggs. At lunch or dinner, add 1 serving of naturally fermented food, kefir, plain yogurt, kimchi, or sauerkraut, alongside garlic or leeks as your prebiotic pairing. And in the evening, between 6 and 8, take a 30 to 45-minute moderate walk. That is it. That is the entire protocol. Now I want to say something directly to you. Your body has not given up on you. The research I have shared today is not wishful thinking. It is peer-reviewed science from some of the most respected cardiovascular institutions in the world. Your arteries retain the capacity to dilate more freely, to produce more nitric oxide, to reduce their inflammatory burden. That capacity does not have a maximum age. Dorothy is now 71. Her blood pressure last month was 128/76. She is on a lower dose of her original medication, and her cardiologist has suggested that if her numbers hold for another 6 months, they will discuss tapering further. She told me last week, "I feel like I got a decade back." That is what these habits can do. Not for everyone, not overnight, but for many people, and possibly for you, the biology is on your side. I want to challenge you right now. Commit to this protocol for 30 days. Just 30 days. Track your blood pressure at home every morning. Notice the trend. And then tell me in the comments what you experienced. As always, please share this information with your doctor. These habits complement medical treatment. They do not replace it. Never adjust or stop any medication without medical supervision. These are lifestyle practices that work alongside your care, not instead of it. One last thing. Tell me in the comments below, on a scale of 0 to 10, how well are you currently managing your blood pressure? And which of these 5 habits are you starting first? I read every single comment on this channel, and those answers genuinely shape what we cover next. Your health is not a verdict. It is a conversation, and you are still talking. I'll see you in the next video.